Yep. All right, folks, Jamaica's healthcare system is once again being scrutinized, and expressing concerns about the current health crisis is opposition spokesperson for health, Dr. Alfred Dawes. I said before that we've spoken to this gentleman many times, but he's wearing a different hat this morning. Morning, my friend. Welcome to Smile. How are you?
Morning. Morning, someone.
Yep. The first time I heard you speaking about the system, it had to do with ventilators. That was the first time I heard, not saying that you didn't have utterances before that. But before we get to that, I just said the healthcare system is being scrutinized. Why? Why are we scrutinizing the healthcare system?
Well, yeah, I did say quite a bit before the whole ventilator story came up, but that has been really sensational because of how it has impacted a lot of lives. But as earlier in the year when we had a travel advisory, that was one of the first, I should say, wake-up calls that we should have had, because never before has the U.S. issued a travel advisory because of the poor state of healthcare in a country. It's usually a pandemic or they have conflicts.
When was that?
I think it was in February this year.
Okay.
And it spoke to the poor state of healthcare in Jamaica. Now, there has been a lot of money spent in health. There have been a lot of infrastructural developments. But the truth is that people go to hospitals when they are sick to get better. And what is happening is that because we're getting into a sicker and sicker population as we age, as our obesity rates climb, as the chronic diseases levels climb, and more trauma as well, we are seeing where the system has not been upgraded to cope with the demands. And as such, we're seeing worsening indices. So the maternal mortality rate has been going up. The neonatal mortality rate has been going up. The infant mortality rate as well has been going up. Our cancer care is lacking because we know that more people are getting cancer, but we are diagnosing cancers at later stages, advanced cancers, because we're just not doing enough screening.
When you say the rates you just said that are going up, because I know we had come down quite a bit and we're doing really well. So contextually and comparatively, when you say up.
So right now, more women, the likelihood of a woman dying during pregnancy and delivery is higher now than it was in the 80s.
Really, though?
Yeah.
Why?
Those are serious numbers.
Why is that?
Well, the official narrative going out, and I totally disagree with it, is that the women who died, they were seeking antenatal care at a late stage, or they were not taking care of themselves in terms of their chronic diseases. That is the official story put out by the Ministry of Health.
You disagree with that?
I totally disagree with that. That is victim blaming. Because when you look at it by region, for example, the Southern Regional Health Authority, they have seen in 5 years between 2017 and 2022, the maternal mortality rates, it has not gone up by 50%, 100, 200, it has gone up by 1,000%. Tenfold increases. Now, you can't say that women in Clarendon, Manchester, and St. Elizabeth are just sicker than women 10 times as sick as other women in Jamaica. There must be something wrong, and it has to do with the delivery of health care, antenatal care in the different regions.
I think it's safe to say in Jamaica, don't know if this is fair, you can tell me, healthcare has been bad, generally speaking, under different administrations. Is it your viewpoint? Are you stating this morning that it's the worst it's ever been? Is that your position? Yes.
By any, if you look at the measures, the international measures that I just mentioned.
KPIs.
Right. It is the worst. If you look at waiting times, they have gone up. If you look at overall the misery index of people who they're complaining about what the service has been like, the complaints are more.
And you attribute that to mismanagement?
A lot of it is mismanagement. You have a ministry that has failed to account properly for $700 billion. You have a ministry that has presided over the biggest cost overrun of moving from $2 billion for Cornwall Regional to over $20 billion with no set time for completion. You're talking about hundreds of millions of dollars just unaccounted for.
Unfortunately, no one from the ministry is here to defend themselves.
But these are in the public space.
What does fail to account for 700 billion mean?
That's between them and the Auditor General right now.
Let's go to the ventilators. And you're suggesting that they're not properly accounted for. And then when the minister came back, and then you said, well, the math's kind of fuzzy. I think that's the word
fuzzy
you used.
Yeah.
Yeah. So explain where you started and why it get fuzzy now.
So the question was never whether or not they were accounted for, because you can account for ventilators that are broken down, ventilators that are in boxes. What I asked for was how many ventilators from the donated units that we got from international partners and Jamaicans, how many are working, how many are functional? And we got numbers like 118, we got 122, the official release, the first release accounted for 54. So the numbers were all over the place. And then when they finally did the complete audit, roughly half of the ventilators were not working. So
the ones that came, you're suggesting broken ventilators came?
No. So what happened was that because they never had a maintenance plan in place, they didn't have spare parts. What they would do is a compressor is not working on one ventilator. They would raid another ventilator, take off that compressor and fix this one that's working. So they pretty much were cannibalizing parts. And that is what led to roughly half of the ventilators just out of commission, missing parts, or just were never be able to be used at all.
When you said there was no maintenance plan, that should come from whom?
Well,
from us here, or the folks who give it to us should be?
No, I mean, we should see. Nobody gets equipment. If you're a businessman, you always have a preventative maintenance plan in place. Now, there's a unit at the Ministry of Health, the HFMU, that deals with maintenance. That unit, as far as I hear, has been gutted. And that is why we're having so many issues with equipment in hospitals, from broken down monitors, the X-ray equipment and ventilators. Now, that is a serious problem. It's almost as if we're using complex medical equipment as disposables. They use them for a while and then throw them out.
So as far as you know, how many did we get and how many are in operation right now as we speak?
Well, the last numbers came out at 210 in the system, and operational, I think it's about 120.
Tell me, build this out for me. Remained in boxes. I cannot imagine that there will be ventilators here that are still in boxes.
Yes. Reliably informed. And in the count, they did say that there were some ventilators were never commissioned.
And these are good. These are
good. They're just sitting in boxes.
And they are brand new. Nothing wrong with them.
Nothing wrong
with them. Are you sure of that, Dr. Dawes?
But I only ask questions I know the answers for. And I was reliably informed that this was the status quo.
But why would that be?
Management issues. You see, it's a matter of priorities. It's all well and good to be cutting ribbons on refurbished clinics and groundbreaking for hospitals, but you have to look at the nitty-gritty of what it takes to deliver healthcare. It is boring, it is not for the cameras, it is a bunch of SOPs, KPIs, and then motivating staff. And that is what has been lacking. We need to train staff, we need to retain staff, and we have to give them the right tools that they need to work with. You know, in all of this, we have 120 ventilators, but I am reliably informed that we have less than 40 functional ICU beds across the island.
How many should we have?
That is about 1 per 100,000. The US has, I think, 27 or 29 per 100,000. Even if you're aiming to be 10% of the US, we should be at least 80. And this is why when an elderly relative gets a stroke or has a bad infection, they can't get an ICU bed because the doctors and nurses are forced to make a decision because they have 5 people competing for the same ICU bed. They're going to give the younger person with a better chance of survival with more, with a longer lifespan.
As someone whose mother needed both an ICU bed and a ventilator when she got ill, this story hits very close to home. I will say that I hear us talking about it now, but this is not a new issue. Healthcare has been terrible in Jamaica, or not where it needs to be in Jamaica for a long time, and I don't know what it's going to take to fix it outside of resolve. I don't know if you're intimating that the minister doesn't have the resolve. I've seen ministers try. It just seems to be in such a state of disrepair. I just don't know how we get it to, to even benchmark with the US. It's like apples and, not even an orange, it's an apple and I don't know how do we fix it? It's going to take, I don't know.
Anyway, again, as I said before, they're not here to respond to your utterances. Not saying that you're not telling the truth, but it would be nice to hear from them also. Good to see you, sir.
Always a pleasure.
Yeah, God bless you and the family. Opposition spokesperson for health, Dr. Alfred Dawes.
All right, coming up next, everybody, parent and teacher conflict. How do we move forward? We'll talk about that after this.